Greetings, aspiring orthopedic clinical specialists. We are going to review the wrist and hand scenario today in this brief tutorial. When I read scenarios, I like paper, so I like to highlight things. So what I'm going to do is I'm going to take you through this scenario and kind of tell you some of the key points that I highlighted as I read it. As I'm reading a scenario, I'm thinking about the questions I might be asked, and the categories I'm thinking of are examination questions, differential diagnosis, prognosis, or intervention questions. So I'm thinking about the information that's going to help me answer those type of questions. So the first thing I see with this scenario is we have a 57-year-old female. Anytime I'm given an age and a gender, I pay attention to it. When we think about age, there are certain conditions that are more likely at certain ages. So it makes a difference whether a patient is 6, 16, 26, 56, 86. So I always pay attention to that age because that can start to help me form hypotheses where I'm thinking, okay, these conditions are in my forethought. These conditions maybe not so much right now, just based on age. So this is a 57-year-old female, and we're given a diagnosis. We're told she has carpal tunnel syndrome. So that helps. So we want to know our diagnoses. We don't have to figure anything out here. We're told carpal tunnel. So now all of your carpal tunnel stuff should be going through your head in terms of what the typical presentation is, what the intervention is, what the best evidence management is. That's what we should be thinking about. We're told that what her job is. She's a legal secretary. She has night pain and paresthesias in the long finger, and it's approximately 3 weeks in nature. So now we're given some symptoms that we were kind of expecting, and how long we've had our symptoms. And that actually, I believe, says 8 weeks. She's right hand dominant, and that's where her carpal tunnel is. And her past medical history. This is always important as well. Diabetes and hypothyroidism. Past medical histories are important, or comorbidities are important, because they make certain conditions more likely or less likely, or they might explain why someone is progressing a little slower. Or if it's an intervention question, maybe the intervention might be a little different based on one of those comorbidities. So when you read a scenario, you can't ignore anything. You can't ignore any information that's given to you because it all comes into play. If you ignore information that's given to you, when you look at a question, there's going to be an option that looks really attractive to you, and it's going to be incorrect because you missed a key piece of information. So do not ignore anything. You need to pay attention to every piece of information we're given. The first question we're asked: which of the following differentials should be considered based on the subjective remarks? So subjective remarks. So we're going back to what she told us. The night pain, the paresthesia in the ring finger is what we're attending to here. And when we pay attention to those complaints and that report, and we look at the choices that were given, we have nerve injuries, anterior interosseous, cubital tunnel syndrome, radial tunnel syndrome. None of those make sense. Option B, C7 nerve involvement. That makes a lot of sense. We're going to have those similar findings in similar regions. So that one makes sense. That's why that's our correct answer. Those other options do not make sense in terms of where her pain is and what her pain is. So again, we have to know what those other symptoms are as well. So we have to know our differential diagnosis. Our second question gives us a little more information here. So now when we're given more information, we have to play it along, and we have to say, all right, now she's having symptoms at work and throughout the day while she uses that computer. So now she seeks medical treatment from her PCP, or primary care physician. She's also supposed to try a wrist splint. Now we're being asked what type of orthosis is indicated. I'm a CHT. This is not a CHT exam. Anytime you're asked about an orthosis or a splint, it's not going to be super specific because it's not the purpose of this exam, but you should know what the indications are, what the contraindications are. And for something like carpal tunnel and the choices we're given here, this is appropriate to know as an orthopedic clinical specialist. So we're just given 4 different choices of splints with the wrist in different positions. And the best choice is going to be C. It's that volar cock-up splint with the wrist in 0 degrees of extension or flexion. The other choices, the other wrist splints, have the wrist at 30 degrees of extension, which will be a little too much. And then the other option is just talking about a thumb orthosis, which is really not going to manage the position of the wrist. So that one would not be appropriate for that reason. So a volar wrist cock-up splint that keeps our wrist in neutral is our best option here. And a lot of this information can come from clinical practice guidelines. So if there's a clinical practice guideline that exists for a certain condition, it's a really good idea to take a look at it and know what's in that clinical practice guideline in terms of outcome measures that are most appropriate, interventions that are most appropriate, examination techniques that are most sensitive or specific. So definitely pay attention to those. And that's where a lot of this information came from. And our next question, typically asks us right off the bat, according to the literature, what clinical tests are useful in screening for carpal tunnel at this point in her disease process? So again, we have to know what clinical tests are indicated and most sensitive and or specific for carpal tunnel. So we read through these and we can see that D is going to be our best choice. We have a carpal tunnel questionnaire syndrome. So of course that's going to work for carpal tunnel. We have 2-point discrimination in Semmes-Weinstein. And that is the most evidence-based battery of tests that were given to quantify carpal tunnel. The other choices, we have a Frome sign, Tennell sign, 2-point discrimination. So Tennell sign is not terrible. 2-point discrimination is not terrible. Frome sign is not going to be for carpal tunnel. That's going to be for a nerve impingement. And then we're given some manual muscle testing in option B and a Finkelstein test. Again, that's not for carpal tunnel. So we have to know those tests and what they're indicated for, what conditions they're indicated for, and what they're not indicated for to get these correct. And option C might look appetizing. We have the quick dash, so that's an upper extremity outcome measure. We have Semmes-Weinstein, so that works. And we have manual muscle testing for abductor pollicis brevis. So those may work, but option D is better. It's got a specific carpal tunnel outcome measure in it. So that is better than just a quick dash, which is just a little more general. So option D is the best choice for that question. Our next question, our last question, asks us about patient education at this point. That's always important to understand with certain conditions what advice you want to provide a patient or what advice you don't want to provide a patient, because we could be asked about that. That speaks to prognosis and it speaks to management. So we're asked about patient education here. And our choices: appropriate use of the orthosis, avoid neutral wrist position, use of small handle grips, and use of therapy to increase grip strength. So the most appropriate one there is appropriate use of the orthosis. We want to make sure that that patient knows how to don that orthosis properly, when they should be wearing it, when they shouldn't be wearing it, things to look for. If you experience this when you're wearing this orthosis, please let me know, because maybe it needs to be adjusted or it's not appropriate anymore. All those other choices, avoiding neutral wrist position. We would want them to be in neutral wrist position. So we don't want them to avoid neutral wrist position. Neutral wrist position is safe for carpal tunnel. Using small handle grips. The smaller the grip, the more force you're going to put through that carpal tunnel. So we'd actually want this patient to use larger handle grips, and using therapy to increase grip strength. It's kind of popular in the clinic, but someone comes in with carpal tunnel complaints, one of the last things you want to do initially is to get them to get putty and to really grab it forcefully. That's going to increase symptoms. So the best choice here is educate them on appropriate use of that orthotic that was asked about in a few questions previous. So that concludes our wrist and hand scenario. So this one focused on a specific diagnosis, carpal tunnel. But I think going through it, it's useful to see that you need to know that diagnosis and you need to know all parts of that diagnosis. You need to know the management of it, the differential diagnosis of it. If there are batteries or clusters of tests, which ones are appropriate to rule in or rule out this diagnosis. And then for this type of condition, an orthotic came into play. So we want to know that condition from beginning to end. And I think this scenario did a really nice job of illustrating the need to know that for us.